Hi, welcome back. I'm Dr. Gill with First Place Chiropractic, and we are in episode 2 of my mini-series about spinal misalignment. Now, in my last episode, I covered how the spine could have misaligned. So tune into that. If you didn't watch it, click on our YouTube page, find us on Facebook or on Instagram, and you'll find that video. You do want to watch that video before you tune into this one. But today we are going to be talking about after your spine is misaligned, what happens within the body. Now in the office, as you know, we practice a really specific technique called nuka. It's all focused on the top of the neck, based on that top bone of the neck, the atlas bone. The reason that bone is so special is it sits right under the brainstem. Now the brainstem controls all of the muscle tone in the entire body. So what happens when that atlas bone misaligns, so if we look at the spine model here, is when this atlas bone misaligns, like I said, it sits right under that brainstem, and brainstem controls all of the muscle tone in your entire body. So when this bone misaligns and it puts pressure on that brainstem, what happens is that the brainstem will send messages for muscles to tighten on one side of the body more than the other, creating an imbalance. Now those muscles come down and attach to each individual bone here. So when they're tighter on that one side, it pulls the spine out of alignment. Now, as the body goes on walking imbalanced, tighter on one side more than the other, the nerves on that side or the opposite side, the nerves that have pressure on them start to dysfunction. So that message between the brain and the body is not being communicated correctly. And oftentimes that leads to stiffness, tightness, and then ultimately pain. Now, if we look at this x-ray here, like I said, we're focused on that top bone in this office. So bringing that atlas bone back into alignment, taking pressure off the brainstem area, will allow those muscles to come back to even from right to left, bringing the entire spine back into alignment without having to twist, pop, or crack it. We're all focused on that gentle adjustment of the atlas. So like I said, if we look at this x-ray here, this is going to describe and display a misalignment. As you can see, the neck and the head are going off that vertical axis. Now after this patient was adjusted, everything looks nice and balanced here, reducing the angles of misalignment, knowing that there is pressure off that brainstem area so the body can start to function better. Now, this is some information on what happens in the body when the body is misaligned. Now tune in for episode 3. We're going to talk about how to fix that spinal alignment and how to maintain it. So stay tuned here. Like I said, follow us on Facebook or wait until next Tuesday's email and you will be getting episode number 3 of Spinal Misalignments.